Hi everyone, thanks for coming to the forum tonight for Colonoscopy 101. So you're all here because you're about to set up your appointment for your first colonoscopy and you want to find out a little bit about the process and what you can expect. So I'm going to talk to you about the different risk factors and the options that you have. Right now, the American Cancer Society, or actually in 2018, they updated the guidelines to, if you're average risk, you would start your screening at age 45 instead of 50, which was prior, back in 2008. That was the last update. So it's the #1 preventable cancer in America. It still doesn't guarantee that you're not going to get colon cancer, but it dramatically reduces the risk by having these tests done. There are two different types of tests. There's stool-based tests, which you can actually do right at home, and then you send in your stool sample to the lab, or you do a visual structural exam of the colon and the rectum, which is your colonoscopy. So we're going to talk about what to expect during the colonoscopy, the 24 to 48 hour preparation. You have to drink a lavage the night before, foods to avoid, and then medication review. The day of the procedure, I'll talk to you about what to expect, processing, the exam, and then the recovery time as well. So average risk, this would mean you would be going in at the age of 45. That would be, this is all if you didn't have any of these history, or if you didn't have any of this history here. If you didn't have any personal history of colon cancer yourself, or any family history, or if for any reason you had a colonoscopy before and they took out certain types of polyps, then you would probably have to be coming in sooner than the age of 45. Also, there's a disease called Lynch syndrome. It's also called familial adenomatous polyposis. So that is a disease that actually doesn't allow your body to fight off certain cancers, and those cancers are the ones in the digestive tract. So if you are diagnosed with this, or you have a family member, it's definitely something that you need to be coming in, more often. Also, if you've had any type of chemo or radiation to the abdomen, belly, or pelvic area, that would put you at higher risk as well. So all of these, if you don't have them, you'd be average risk. If you have any of those, or any of the two inflammatory bowel diseases, you would actually be coming in to have a colonoscopy even as young as teenage years. So it just depends when you first get diagnosed. But so the first one is ulcerative colitis. It's a long-lasting inflammation that causes ulcers in the colon, but it only happens in the large intestine. The Crohn's disease, they're both kind of similar. It's a long-lasting inflammation as well, but it can affect different areas within the digestive tract, and it affects people differently. Those two would bring you in to have a colonoscopy. Oh, before I go there, I actually want to just point out, so this is the colon, or here's the stomach. This is the large intestine right here, okay? This big one. So this kind of shows the ulcerative colitis. This is where you're having more inflammation towards the beginning of your colon. And then this is Crohn's disease, which, as you can see, you may have, different inflammation areas throughout the colon. So this causes things like diarrhea, abdominal pain, things like that. So if you have any of those symptoms, definitely want to get those checked out too. So the screening plans for the high-risk colonoscopies, if you did have any of those bowel diseases, you would have to come in for surveillance colonoscopies more often, maybe 1 to 3 times, or 1 to 3 times a year. Or no, I'm sorry, every 1 to 3 years you would be coming in for a colonoscopy. And then they do biopsies to ensure that it's not progressing, or make sure the medication's working too. So they'll put you on different types of medications depending on, your symptoms and the severity of it. So now I'm going to talk to you a little bit about preparing for the colonoscopy. So a week leading up to it, this is what you want to stay away from, mostly because they they're hard to digest, so they stay in the colon for a while, and sometimes it can make it hard to see, so we want the colon as clean as possible. It also actually clogs up the colonoscopes sometimes, so you want to stay away from all that. Talk to your doctor if you're taking any iron supplements, because it could actually cause black tarry stools, which could look like blood. And if you're taking any blood thinners as well, you might need to get off of those for about 5 days before the colonoscopy, because it'll put you at higher risk for bleeding. So the day of the colonoscopy, the day before the colonoscopy, you're going to be on clear liquids. You could have Jell-O, popsicles, broth, apple juice, tea, coffee, water, but you can't have anything red. So if you have the Jell-O and the popsicles, it has to be green or blue, yellow, but just not red, because it could look like blood when we're doing your screening. So the day has come and you're coming in for your colonoscopy. So you come in and we start your IV. We give you medication through the IV. It's called conscious sedation. So you will be, most people fall asleep. Some people are in and out of sleep. Mostly you won't really remember. The goal is to keep you comfortable. So basically, we have a scope that we use. We go into, you're lying on your left side, and we, put the camera in, and we're able to look on the screen. Here, I'm going to show you just this is basically what the scope looks like. So the doctor's able to kind of, maneuver through the colon. The colon has many twists, and it's like 3 to 4 feet long. But as you can see, it's the new 190 advanced scopes that we have here. They're really easy to maneuver through the colon. People don't feel much. If you feel anything, it might be a gassy feeling, but we'll talk, the nurses talk to you. You're able to listen because it's not full, anesthesia. So yeah, that's that. And then also, I wanted to talk to you a little bit about what we're looking for. So these are the colon polyps. This is what we're actually going to see if you have. So this is what a normal colon looks like. And then these are what's called different polyps. And those are the growths that grow in the colon that could become cancerous, or could grow into tumors. They're slow growing, most of them, but this is why, like, if you had a clean, normal colonoscopy, you wouldn't have to come back for 10 years. But if you came in and you had just a small, small polyp, something small, you may come in another 5 years, But if you have a bunch of them or really big polyps, like these, that could mean you may have to come in every 1 to 3 years. And then all these go off to pathology to see, to get the results and see what kind of polyps they are and if they are precancerous or not. So that's about it. And I hope you guys got the information you needed, and you can just call the 877 number to schedule your appointment. And if you have any questions, I'll be here to answer them. Thank you.